fun. Hello everyone, welcome back to our podcast. My name is Elena, this is Dr. Gabella and Dr. Blake. Today we'll be talking about dysautonomia, and Dr. Blake, I'll let you get started in that one.
Of course. So has anyone ever felt dizzy or lightheaded if you stand up too quickly? Me too. So this is just a podcast going over a small fraction of what people with dysautonomia may experience. So we'll get into about how to go about if you have an unbalanced autonomic nervous system, kind of what that would look like, and then how to go about treatment and how to get back to your life.
Absolutely, and we do know that sometimes it's really tricky to get the right diagnosis, and people kind of go through that period of the unknown, not understanding why they feel a certain way, going to several providers and being misdiagnosed and still having some pretty debilitating symptoms. So we're going to dive into some of that today.
Yeah, just quick background, my sister has actually been struggling with this.
Wow.
And it took her years to get diagnosed.
Yeah.
She was getting bounced around from provider to provider, specialist to specialist. Another thing that people often don't think about is how it also is very time consuming, because in order to get scheduled out, it's like half a year to a year in advance.
Mm-hmm.
So, but eventually she actually ended up seeing a cardiologist who normally they're not that great, I feel like, at diagnosing, but he actually was very well versed with what it was, and he finally was able to give her an answer to that. But yeah, it's a very frustrating process.
It is. Sure. I didn't realize your sister was experiencing that. So, when we get towards the end, you should totally share some personal information. That'll be awesome. Definitely. The other thing is we know that we did just go, and I say just went, but it's been quite a few years now, but COVID had a big impact on our population. And I think one of the positive things that it did, it opened eyes to the public that dysautonomia was a thing, and it was a real thing that people had been struggling for decades, and a lot of providers just didn't really understand it. But it became a lot more prevalent because that long hauler presentation caused a lot of issues within the autonomic nervous system for patients. And it became well versed and well known, so that cardiologists were starting to diagnose it better once they realized that it wasn't a heart issue and there's something coming from the brain. So definitely. So we'll jump in. I'm just going to go right into what dysautonomia is. I'm going to try to keep it simple, and then we'll go into some more deeper scientific information. But on the simplest level, dysautonomia is just an imbalance within our autonomic nervous system. So first we're going to say, what is the autonomic nervous system? So the two parts of it are your parasympathetic and your sympathetic nervous system. And typically we tend to think of them as being two opposing, very different systems, but that's really not the case. They always are working in conjunction to do different things, but it's important we have a great balance between the two, and it's not so black and white like we like to make it. Because it's so complex and so important, like it's vital for our existence. It's vital for us to have blood control throughout the body. It's not easy, but the more complex systems are in the brain, the higher probability there is for these pathways to get damaged. And they can be damaged for many reasons. Like we know viruses and infections will do it. So we know the whole COVID presentation. There's several other different viruses that can also do it. We know that concussion will do it. And we know that just slow and gradual toxin exposure, whether it's pollutants in our environment, whether we're inhaling things, we're eating things, and different forms of insults to our nervous system can end up leading to it. Every patient is different, so they also have a very different presentation. And let's go back to the basics of it. So we got parasympathetic and sympathetic, and so first thing we say is, why is that important? So we have to have a system that is going to supply blood throughout the whole entire body, specifically to the brain, but also to every cell in the body. So as I sit here and we're discussing dysautonomia, I'm thinking in my brain, I'm accessing stored memories so that I can share this knowledge with you. I'm articulating, having speech, my mouth is moving, my hand is moving. So all these things are happening in the periphery, right? The expression that you're seeing right now, my mouth is moving, my hand is moving. And so I'm shunting blood to my mouth and to my hand, to my limb, so that I can do this. But I'm also having to shunt blood to every single area of the brain that is now working in this moment right now. So it's a really important job, and when I don't do it well, it fails me, and I struggle to think, right? Or I maybe freeze, or I can't word finding, things like that. Or let's say maybe I get cramping or coldness in my limb. Like there's different expressions of it. But it has to work well, and it has to work well all the time. We live in a world of gravity, which is really important. It's really beneficial for the brain, but we have to always keep that in consideration too, because we're changing our angulation in gravity at all times. If I go from sitting to standing, if I'm walking, I'm now moving in gravity, which means gravity is going to pull blood down to my feet. So I have to have a system that's going to sense what my body is doing in reference to gravity, and it's going to send that message to my autonomic nervous system so that I control my blood pressure and my heart rate accordingly so that I'm always getting blood to the brain. And this happens without us thinking, and it's beautiful and majestic and everything is wonderful, and we feel fine until it breaks down. And then all of a sudden, if you are a patient with dysautonomia, you know how terrible it feels. You know, the lightheadedness, just being in your world and feeling disoriented. You don't know where you are. You're not grounded. And then ultimately, it's very dangerous. You know, we struggle with the hypoxia or decreased cerebral perfusion, which is blood flow. And that is not good for our survival. So our nervous system fires our limbic anxiety system, which is very natural, and that's a normal response because it's important that we make sure we get enough blood to the brain, right? So there's that. And then we have all these other branches of your autonomic nervous system that I want to cover on because it'll help explain some of the symptoms that patients have. So we not only just have that autonomic, parasympathetic, sympathetic, and parasympathetic is more of your rest and digest, the more calm. If you want to sleep, if you want to go to the bathroom regularly, allow your gut motility to work, we're in more of that parasympathetic mode. Sympathetic mode is that fight or flight, but it's more so that focus and concentration and dopamine release, right? So that we can learn things and we can think fast on our toes. Or if we're out in the field and a bear is attacking us, we can respond and get away from the bear and think appropriately and quickly. So these systems are working all day long, synapsing on all the neurons in our body to do different things that work in conjunction together. So important. So a lot of people like to think the sympathetic nervous system is bad, but it's not. So important and vital. So the other systems that are very much involved with the autonomic nervous system is something you're probably very familiar with. Your hypothalamus, pituitary, adrenal system. So people think about this all the time as our stress system. And it's also involved in our homeostasis, so our temperature, whether we're cold or hot or sweaty. And people with dysautonomia struggle with that a lot. They also struggle with their sleep-wake cycle because our hypothalamus is involved in all of that. And we have some really incredible nuclei that are in the hypothalamus that then fire down to different baroreceptors in our neck that allow us to detect pressure changes in gravity so that we are controlling our heart rate and blood pressure accordingly. So it is a very, very complex system that I'm sure we'll have multiple podcasts on. But just as a start, that's what it is. And it's also super amazing. But the complexity of it is why there's so many symptoms that you can develop and why it's also so debilitating because it's so important for it to work well for us.
Yeah, that was a good explanation.
Good, thank you.
Yeah, thank you. Okay, so next I would say, so I know that there are different types of dysautonomia. So my sister, she has POTS. So what are some of the different, like, I don't know if you would call it subdivisions or something of
absolutely.
dysautonomia. So if you could touch up a little bit on that, that would be amazing.
Yeah, so dysautonomia is a branch term. And there are several conditions that can fall under it. We could also see somebody having dysautonomia that has, maybe they just have cardiac issues, or maybe they have a neurodegenerative disorder like multiple system atrophy. They'll have dysautonomia. But typically, the big terms that people are hearing are the POTS or the vasovagal syncope. Dr. Blake, if you want to kind of chime in on either one of those.
Yeah, I think a lot of times too they can be very confusing when it comes to a patient because you may think, oh my gosh, I have POTS, but if you've never been tested for it, then you don't know it could be this huge difference between the two. So dysautonomia is very much like an umbrella term when it comes to vasovagal syncope and, POTS. And then a lot of times too, you'll see it a lot in younger women too. I know that's something we'll probably touch upon a little bit later, but the diagnosis also is very, very different.
Yeah, it is very different. So when we talk about POTS, we're talking about those positional changes in gravity, and it's an orthostatic tachycardia. So what that means, orthostatic, is that you're moving in gravity or stasis, and you're getting increased heart rate, tachycardia. So tachycardia is increased heart rate, bradycardia is lower heart rate. And the reason it becomes an issue is generally when your heart is pounding, it's really, really high. The normal response for heart rate to increase means that your blood pressure has dropped. So generally what you're going to see, if you have somebody that stands up and they have high blood pressure and high heart rate, they're not going to really get lightheaded. Where the lightheadedness comes in and we have an issue is where you have a lower blood pressure, your heart rate is going high, 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 trying to get that blood pressure to come up, and it fails, that system fails. So you're just pounding away, your heart rate is crazy high, and it's not doing anything to bring that blood pressure up. So that's where you see the POTS, right? And so then you have that vasovagal syncope, and that's where the ones that have a little bit too much parasympathetic vagal tone. So vagal tone is one of our largest parasympathetic fibers. It's going to lower blood pressure, lower heart rate. Well, that becomes very problematic. When I go from sitting to standing, I'm translating upward in gravity. The baroreceptors, it's a receptor, a pressure receptor in our carotid arteries. They're detecting pressure changes. So if I go from sitting to standing, the pressure change from gravity in my baroreceptor is going to increase, and it's going to say, okay, she's standing in gravity. My vestibular system is also telling my brain that I am standing up, I'm translating upward in gravity, and I need to increase my blood pressure and increase my heart rate because I need to counteract the pull of gravity where it's going to take blood down to my feet. I have to have a mechanism to do so. Vasovagal syncope is one of the worst scenarios because the fact they do not increase their blood pressure and they do not increase their heart rate. So they pass out, and they pass out because they become hypoxic. They lose so much blood supply to the brain that they pass out, right? And so generally, not only passing out is a problem because you have the hypoxia, neurons die if you cannot get oxygen and glucose to the brain. And we get it in the form of blood supply, right? But when you pass out, there's a higher likelihood that you're going to crack your head on something. So then you got the second insult that's about to happen. You're hypoxic and you get a concussion at the same time, and that really sucks. It's not a good scenario at all.
Is this something that, I don't know, could be like genetic at all? Or if your mom struggles with this, is there a chance that you could also have it?
Absolutely, but would not be genetic, right? Okay. So we know that women are predisposed to it. And we know that women are predisposed to a couple different things, like autoimmune disorders and things like that. That doesn't mean that men don't get it. Men absolutely get it. We just see a higher prevalence in females. We also see a higher prevalence when they're younger. And there are some familial things that are passed on, like your mother may have low blood pressure, low heart rate, and you're more likely to have it. Or sometimes we have these different blood vessel variants that get passed on. A lot of times in Mediterranean descent, you'll see people have more of a genetic predisposition towards dysautonomia. Does not mean that you're going to have dysautonomia, right? So I know personally in my world, I am definitely genetically predisposed to dysautonomia. I don't have it because I live in a world that I understand and I'm able to treat it and things like that. But when you're not, it kind of stinks, right? Because little lifestyle things can change you from functioning normal to now functioning abnormal. For example, you could be sick with any infection. It doesn't even have to be an infection that has an impact on our brain. But just because your energy and resources and blood supply are going to fighting the infection, during that period, you can be predisposed for having a syncope episode or, having an episode where you stand up and you faint and pass out because you were a little predisposed on that side of dysautonomia. So you can be predisposed and be completely healthy, right? It's when you kind of cross over that threshold where it becomes unhealthy for your whole entire nervous system. Because the main thing we have to remember, the take-home point, most simplest level, what our neurons need to survive is activation, number one. But when they get activated, we have to get a blood supply to them. We have to get oxygen and glucose. If that system fails, those neurons begin to get really unhealthy, and then eventually they die off. And that's, devastating. We lose neurons every day, but yeah.
Okay. What are some symptoms and red flags with dysautonomia?
We're gonna let Dr. Blake talk a little bit, and I'll chime in.
Yeah, definitely. I would say so. Probably the most common presentations people might see, and part of the reason why this is so hard for patients themselves to realize it is because it can look like so many other different disorders. So a lot of times it's, like I said before in the beginning, that dizziness when standing up. People may notice that their heart rate may spike out of nowhere and they don't know why. That can either be from sitting to standing, or they're walking around and maybe they experience something stressful and they don't know why their heart rate isn't going down. Another thing that people may experience is that they maybe have cold, clammy hands, cold feet, colder extremities. People may think, oh, this could just be, maybe I have an iron deficiency or something along those lines. But when in reality, it could actually be functional or brain-based. And this is just a small aspect of so many things that people with dysautonomia may experience.
Yeah.
It can also be, it may look like a rash on your legs. It's kind of like this almost marble-like sensation. And a lot of times people may think, oh, let me go, to another doctor just to check out my skin. Like maybe it's not something related to blood flow. They think it could be related to something superficial like their skin. So there's so many different things that it's very easily confused for dysautonomia, which is why it's so difficult to diagnose.
And that kind of goes back to the predisposition of certain things, right? So a lot of people will have different blanching, and they'll come in and we'll always ask, did you have this your whole life? Because you can have these things that are pointing to a disruption within your blood supply and your autonomic nervous system, but it could be completely normal for you, right? You haven't passed that threshold to being symptomatic. So the blotchiness and things like that, I've always had that on my legs too as a young child. So if you do have it, it's no big deal. Don't freak out, right? You just got to be aware of it, because it could take, concussion or an upper respiratory infection to put you over where you do start having symptoms. Some of the things that really typically present with dysautonomia, because our ability to control blood supply is so interconnected, is migraines and headaches. So that's a really common one. I think I'm not sure if we've had a podcast about it, but I know I've talked a lot about it because it's a confusing world. But ultimately, migraines and headaches, the pain in the head, is only going to be triggered by nociceptive fibers along our capillaries, and that's getting vasospasm, which means the blood vessels getting smaller or larger. That change in diameter can trigger a headache, and that's where we feel our pain. We don't actually have pain receptors on brain tissue. It's along the blood vessels that supply the brain. And then you also can see a lot of dizziness, lightheadedness, because we know that the vestibular system is so closely related to the autonomic nervous system, because it's always having to send that signal of where we are in space. Am I tilting forward? Am I rotating? Am I standing up? What am I doing in my environment to tell my autonomic nervous system how it needs to perform for me so that I get the proper blood supply throughout my body? So you also see a lot of the dizziness. You'll see brain fog, people just super foggy. You cannot think, right? You cannot recall words or problem solve if you're not getting the proper amount of blood supply to your brain. So you often see that, and you'll see some cognitive decline. A lot of exercise intolerance, right? So people that want to go work out, when we're working out, we're shunting blood to our muscles, right? That's how we build muscle tone. Well, if you're working out and you're shunting blood to your muscles and you're already not getting enough blood to the brain, guess what? That doesn't feel good. You're super exhausted, faint, pass out, have all these symptoms, and that's what we categorize as that exercise intolerance. You'll also see these temperature changes, people quickly getting hot flush. Maybe they wake up in the night and they're sweating. You can only imagine you go to your doctor and say, hey, I'm sweating in the middle of the night. It could be diagnosed as so many things and just kind of brushed off, right? You'll also see this component of anxiety, because I mentioned before, if you are not getting proper blood supply, if you're experiencing dizziness in your environment, that is very unsafe, okay? And it's a protection mechanism that your brain is going to fire into that limbic system and trigger some anxiety because you're not stable in your world and your autonomic nervous system is not controlling blood supply appropriately. You can even get those adrenaline rushes, right? Where, like, let's say you're presenting something and you're really thinking complex stuff, and so you're using your cognition and you're releasing a lot of dopamine. All of a sudden afterwards you start getting like chills and things like that. You know that's an issue within your autonomic nervous system. That's kind of like an adrenaline dump, things like that. So there are quite a few symptoms. And then you also get changes in limbs as well, you know. So not only temperature change, but people can get physical pain and things like that.
Oh, wow.
Yeah.
What about GI issues?
Oh, huge GI issues.
Also,
Yeah,
okay.
good call with that one. Yeah. So because we know that our digestion and gut motility is controlled by parasympathetic nervous system, right? If we're high sympathetic tone, we're not getting enough parasympathetic tone to our stomach. We're not digesting food. We're not moving food through our body. A lot of times you'll see the constipation, or a lot of bloating, you know, after meals. Also GERD, acid reflux. So we have a sphincter at the base of our stomach that is controlled by our parasympathetic nervous system. And that sphincter is meant to squeeze really tight. So it's a muscle that squeezes really tight. Well, if we lose that sympathetic innervation to the stomach, that muscle becomes weak and it allows the acid to regurgitate into the esophagus. And so you get the acid reflux. So that's a common thing that comes along with it. Yep.
Yeah. So it's definitely more than just feeling dizzy.
Absolutely.
Feeling dizzy is just kind of like almost like the same umbrella term.
Yep.
There are so many other components to it that a lot of people struggle with.
Absolutely, yep.
Yeah, I also want to just touch upon briefly because Dr. Gabella mentioned anxiety. A lot of times patients too, they'll mention, you know, I'm not an anxious person, I'll just get these flashes out of nowhere. So I just want to reiterate that you can just be, you know, in the grocery store and you could be doing fine, then all of a sudden you just get this rush of anxiety and you immediately just feel I have to go home. And a lot of times people might think, you know, they might be going crazy. You're not. It's just simply, as Dr. Bell was saying, it's your body's response in trying to protect itself.
Yep, absolutely.
Yeah. How about different like environmental tolerances? So people with dysautonomia, can they handle like very hot environments or very cold? Does that have an effect on them as well?
Yeah, it will, because obviously we're talking about the hypothalamus pituitary adrenal system. We're talking about the temperature regulation of our body. So people will have a lot of these hot and cold intolerances, and you could be one way or the other, right? So it's not cut and dry. Some are very specific, like I don't tolerate heat well. Some are very specific to I don't tolerate cold well. So yeah, but it's not easy when you're dealing with, it's called thermoregulation. And it's a lot of stress on the body when you can't do that well. We really take advantage of it when our blood pressure and heart rate is working properly and our thermoregulation is working properly. We don't think twice, and then all of a sudden it fails. And it's like, it's very difficult to do just about anything.
All right.
Yeah.
Well, I think now would be a good time to talk about how and why it's so prominent in young women especially. As we said, everyone can get it, but we see it a lot in our younger female patients.
Yeah, a lot of it is just the female body, right? So we do know that the female brain is more complex, which means it has more connections. It is smaller anatomically, but the size doesn't really matter. The connections matter the most. So exciting for us women, but also sometimes really difficult because we're more susceptible to complex neurological disorders, more susceptible to that suffering aspect too. Just a little bit about suffering. The more connections you have in the brain, the more intelligent, or let's say you're an athlete, the more skilled athlete you are, you have more connections in the brain. When that's the case and you injure your brain, you're going to have more pathways that are going to allow that perspective awareness. So you're going to be able to perceive your deficits, and there's more suffering involved. And so you see that with dysautonomia too, because you'll have like a super bright, sharp female in the early 20s, and all of a sudden they pass that threshold and they're in that dysautonomia range, and the floodgates open and they feel terrible, they're hypoxic, their brain is just getting worse and worse. So when we're talking about hypoxia, that's not getting enough oxygen to the brain. You can't get enough oxygen in the brain, those neurons die off. So it's very quickly, if you're not being treated for these things, your brain goes downhill fast, and it sucks. It's debilitating, and there's a lot of suffering involved. Yeah, and so the female population, the younger 20s, and this can happen in males at all ages, right? It's just kind of generalizing. We have a larger population and demographics that are affected by it. And a lot of people ask, like, how is it diagnosed and treated? So the key to dysautonomia-specific POTS and the vasovagal syncopes and things like that, it's blood pressure and heart rate needs to be monitored. And more specifically, it needs to be monitored in different angles of gravity in reference to gravity, right? So if I'm seated, I have a very different autonomic demand on my heart rate and blood pressure versus when I'm laying down, versus when I'm at 15 degrees, 30, 45, 60, 75, 90, right? So it's standing up, laying down. So that's exactly what we do is we put the body in all these different angulations, which is called the tilt table, and we take a blood pressure and heart rate recording, and also pulse ox, which is your oxygen perfusion to your limbs. So you want to see what's the percentage of oxygen that's getting delivered to the patient's limbs as well. And we know what it should be. We know how fast it should respond to changes in gravity. And we say, what's happening in this patient's nervous system? Are they getting too high sympathetic tone here at 30 degrees? Not enough parasympathetic tone at 90 degrees, like what's happening at each degree? And it is very different. So we like to put a blanket term on it and think that, you know, if it's happening at 30 degrees, it's also happening at 90 degrees, and that's not the case at all. So it's really important to look at that, and it's really important to say, okay, so theoretically, what areas of the brain can we activate to help normalize this, to help create a normal response within the autonomic nervous system, whether that's increasing parasympathetic or increasing sympathetic tone at the correct angle. And that's exactly what we do. And we add treatments in on those tilt tables, and we do that, and we add some cognitive and eye exercises and vestibular stuff in this beautiful way, and all of a sudden we're able to rewire and build new connections in the patient's brain and create integrity within these pathways that they feel so much better. Like there's symptomatic recovery, but also functionality. So when your symptoms are better, when your heart rate and blood pressure is correct, when you're doing certain things, you can think clearly. You don't have the brain fog. You don't have the anxiety. You can now work out, right? And everybody's at a different stage, you know, and some patients come in and they're really, really bad off and they've been struggling with dysautonomia for years. Some patients are in a wheelchair. They can't even get out of bed, right? And then you have other patients that are early on and they're still working and they're still working out, and it's much more mild form. So there's different ways of treating it all depending on where the patient is at, and all treatment is very much tailored to the patient's brain specifically.
All right.
Yeah.
So someone who is experiencing these symptoms, what is a good first step for them to get it checked out? So we know it's not a heart issue, it's coming from the brain. So
right, and initially you may not know that it's not a heart issue, so you might go to the cardiologist, and that's great because you know what, you're ruling out that it's not a cardiac issue, and you know there's nothing serious or acute going on, and so you kind of go down that pathway. If you've already gone down that pathway and you're having some of these symptoms of dysautonomia, I totally suggest you absolutely go to a functional neurologist. You know, there's other fields that can treat certain disorders, but when it comes to dysautonomia, it's really the best way to go, mostly because we're looking at the brain, and the brain is what controls your autonomic nervous system. And yeah, it's been a population that has suffered for so many years, so it's been a big focus in the functionality world to help treat these patients, and you have to be careful because doing the wrong thing is devastating, right? We're talking about blood supply, and it's a big deal.
Yeah. So like my sister, for example, what she was suffering with was, so when she was in her late teens, she cannot tolerate heat very well. So especially if she's been standing for a long time, she would have these episodes where she would pass out, and we didn't know why that was happening.
Yep.
So for the longest time, she didn't really get it checked out because we also hear that it's very common for younger women to just pass out randomly.
Right.
But it kept on happening, and we've noticed a pattern. So eventually, she did end up going to cardiologists, and they're the ones that figured it out.
Yeah.
One thing to note was that honestly, her symptoms really were not that bad.
Yeah.
It's something that is very manageable, and we have to thank our mother for that because we were thinking that we had a very, very healthy and active lifestyle growing up. So we would go on walks all the time, runs. She made us do sports. One big thing was swimming.
Yeah.
And I recently read somewhere that swimming is actually really
very good for dysautonomia.
Yeah.
The reason being is swimming takes you out of gravity, right? So it's a little bit easier, right, to tolerate, and you're still working a lot of muscles with swimming. So swimming is a great option, especially if you're really struggling with just moving around in gravity. Exercise is huge, right? So the problem is you have dysautonomia, and all of a sudden you feel terrible getting up and moving around your world. So you stay sedentary and you don't do things, and that's kind of the worst thing, because there is this whole aspect of deconditioning. So if you are in that scenario, you haven't worked out, you haven't moved, the movement is really, really important, like Elena was mentioning. Where you can start is just with like a recumbent bike, getting up, and a lot of changes in gravity when you have bad dysautonomia is very difficult. So being stationary, being able to sit down and just pedal on a recumbent bike. We also noticed that building tone in the legs is really, really helpful for managing dysautonomia symptoms. So you want to focus on the legs first. One of the reasons is our legs and our muscle tone, our extensor muscles, fire to the brain and tell us that we're upright in gravity. So it helps with the relay signal that we are standing. So it is a very important aspect of muscle tone and things like that. So recumbent bike is a great area to start, and then you slowly increase it. And I would be very mindful of a lot of this up and down type of movement, because when you have dysautonomia, those are things that are going to trigger you.
Yeah, it's like leg press.
Yep, leg press is good. Yep.
Yeah.
Yep, definitely.
Gotcha.
And you just take it slow. Like everything is very light, very slow. Take your time. Make sure you're breathing. Make sure you're checking in with yourself, seeing how you feel. Yeah. And walking. Walking is great. If you have to walk super slow, fine. You just walk super slow and you slowly increase it.
What are some other tips that you have for people that are trying to manage their symptoms?
Diet is really important. You want to eat a really good diet. You want to stay hydrated, drink lots and lots of water. If your blood pressure is low, one way you can increase your blood pressure is by increasing your salt intake. So you definitely see a world of the electrolytes and things like that. So increase salt. There's so many different brands. I think Dr. Blake has a brand she likes, she can mention. Compression socks are super helpful. So what it's going to do, it's going to create more peripheral resistance. So you put some compression socks on, it's going to help the blood, instead of it pulling to your feet, it's going to help the blood come back up to your heart if you're having those blood pressure and heart rate changes and autonomic dysfunction. Yep, so those are some really good things. And then again, move as much as you can, and that looks different for everybody. Vibration is really good. So even if you can't move that much, you can get a little vibration plate, put your feet on it, things like that. You want to get joint proprioception. You want to activate your muscles and things like that, because when we stand up, it's not just your vestibular system. You're getting afferent input from your muscles and joints that you're standing up, which is very different than us sitting down right now. We're not using our extensor muscles to stand upright in gravity.
Absolutely. Yeah, I completely agree. Even if it's hard to get out of bed, try your best to just move at least a little bit each day. Like Dr. Bell said, the vibration plate. And for electrolyte packets, I love the brand LMNT. It does taste a little bit salty, so it's on the saltier side, but it has potassium in it. It's great to just put
You definitely
in
want
water.
potassium in your electrolytes too. That is something that people don't realize, but it's super important. And any brand is fine. Dr. Blake just really likes that brand.
Yeah. From personal experience.
Yeah, I'll definitely have to check that out. I usually do liquid IV, but I feel like that can be a little bit too sweet at times, especially if I'm trying to drink it a little bit more regularly.
Yep.
Could you touch a little bit more on diet? I know that on social media we've had a lot of questions with what they should or should not be eating. So you did just mention electrolytes, potassium. That's a great start.
Yeah, I think it's important to have a balanced diet, right? So minerals are super important, and we get minerals from having a good source of our vegetables, fruits, but also meats, right? And things that are gonna affect our autonomic nervous system are things that affect our blood. So if you are borderline anemic, it's not gonna be a good thing. It's gonna make all your symptoms worse. So it's important to eat red meat, not just for the iron, for females, especially that demographic of females are typically low on iron, younger, skinny, petite frame. females struggle with that. So you do want to make sure you are getting some red meat in there, but also organic grass-fed red meat has a fat profile that is excellent for the brain, so it's super important. If you're vegan, you just want to make sure that you are getting sources of, complete proteins as best as you can, and you're definitely gonna have to be eating more protein than you realize to be sure that you're getting the complete form of protein that is bioavailable for the body. But yeah, protein is a super important thing, especially if you're not moving around and you're just sedentary. You're gonna lose muscle mass. When you lose muscle mass, you get deconditioning, you get your capillaries lose their strength. You wanna keep those capillaries very, very strong, because the capillaries are what's gonna be supplying our veins and our blood vessels that are pumping blood throughout the body. When you decondition and your muscles become weak and you don't move around, you also get weakness within those blood vessels. So that's not a good thing either.
All right.
Yeah.
Thank you. That's all I have for you guys actually today. You guys did a great job discussing and providing insight on what dysautonomia is. I think it's a term that is starting to get a lot more traction these days, and I'm really glad to see it, because
Super important.
a lot of people are starting to finally find answers for just problems they've been having for a while. So it's great to see all the support for it.
Definitely.
Yeah.
We're super excited to share the information, and the more we can educate you, the better choices everybody can make, and that's our goal, is to help solve some of these big questions and health crises that are going on.
Yeah, absolutely. Well, this concludes today's episode. Thank you for watching. See you next time. Bye.
Thank you.